Assalamu alaikum. My name is Naseema Rafiq and welcome to my channel, The Cool Principal. Please like my channel, subscribe my channel and be with me for the upcoming new videos. Now we are going to learn how to wear PPE, and the purpose of wearing PPE is if we are going to visit any infectious patient and if we are going to isolation room. So let's start the procedure. Gown, gloves, N95 mask, goggles, face sheet and cap. Let's start the procedure. If you are not going to use the goggles and the cap, then you can use mask sheet. Then you have to wear this one and then you will not use the other things. But here I am going to use the cap and the mask. That's why I am not going to use this shield. Or you have to do the hand hygiene first. To learn how to do the hand hygiene, please watch my previous video. Okay, so I have done with the hand hygiene. Now I am going to start with the cap. So actually I am wearing hijab. So with this hijab, the cap is not required. But if you want to wear, if you are not wearing hijab, then you must wear the cap. Okay, after wearing cap, then you have to wear the mask, the N95. And hold the both ring to your ears and pinch at your nose. Okay. Now my mask is ready. The next thing I am going to use is the goggles. Okay. My goggles are ready. After wearing goggles, I am going to wear gown. So take the gown, open the gown straight, and then wear it. Okay, my gown is ready. So I need assistance from someone who will tie my gown. You have to keep your hands straight because you have done the sterilization, so your hands are sterile. Then the last thing I am going to use are the sterilized gloves. So how to wear sterilized gloves, you can watch my previous video or hold the gloves, okay, and insert your forefinger and thumb. Place your forefinger, place it down gently. Okay. So now you are ready to visit the infectious patient, but before entering to the isolation room, then you have to cover your feet also with the cover. Thank you so much.